A 25-year-old male presents to the emergency department with a 24-hour history of abdominal pain. The pain initially started around the umbilical region and later shifted to the right lower quadrant. He reports nausea and loss of appetite but denies any vomiting or diarrhea. His past medical history is unremarkable, and he has no known drug allergies. History and symptoms. The patient describes the pain as a sharp, constant ache. On a pain scale of 1 to 10, he rates it as 7. He also notes that movement and coughing aggravate the pain. No history of recent illness, but he mentions a mild fever since the pain started. On examination, the patient is mildly febrile, with a temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius. Abdominal examination reveals tenderness and guarding in the right iliac fossa, specifically over McBurney's point. There is rebound tenderness, and a positive Rovsing's sign is noted, pain in the right lower quadrant when the left side of the abdomen is palpated. Additionally, the psoas sign is positive, indicating irritation of the iliopsoas muscle. Investigations. To confirm the diagnosis, the following investigations are ordered. 1. Complete blood count. CBC shows leukocytosis with a neutrophil predominance, which is typical in appendicitis. 2. Ultrasound of the abdomen may show a non-compressible, dilated appendix, sometimes with surrounding fluid or abscess formation. In cases where the ultrasound is inconclusive, a CT scan of the abdomen is recommended, which typically reveals a thickened appendix greater than 6 mm in diameter, with periappendiceal fat stranding. At this point, our main differential diagnoses include acute appendicitis, gastroenteritis, mesenteric adenitis, right ureteric colic, Crohn's disease, ovarian pathology in females. From the lab picture and imaging we come to a diagnosis of acute appendicitis. In summary, acute appendicitis is a clinical diagnosis that requires timely surgical intervention to prevent complications. Laparoscopic appendectomy remains the gold standard for treatment, and early recognition of signs and symptoms is crucial for positive outcomes. That concludes our discussion on acute appendicitis. Understanding the clinical presentation, diagnostic approach, and management is essential for all medical professionals, especially in emergency setting.